You talk a little bit about what you do and discuss how nutrition and diet work into what you do on a day-to-day basis helping people.
Okay. Well, the program that I use involves modifying the diet, taking large amounts of supplements, and doing detoxification routines. So I can go over those one at a time. As far as diet goes, the diets can vary actually from person to person depending on what type of problem they have. So, for example, typically people that are the kind of person, so to speak, that would develop a cancer that's called a carcinoma, like breast cancer or colon cancer, those people tend to do best on a more vegetarian type of diet where there's some eggs, some fish, some animal protein, but not a lot. Most of it is vegetarian. Then there are other types of patients who are the kinds of people that would develop a blood dyscrasia, for example, like leukemia, lymphoma, myeloma, melanoma, some of those types of cancers. And those patients we find do better on a diet that's high in protein and fat. So they would be told to eat a lot of animal protein. And there's a kind of a spectrum, but most patients do tend to fall into one or the other extreme if they have issues enough to develop cancer in the first place. All of the diets do stress organic food, whole foods, raw foods, vegetable juices, those kinds of things, because a cleaner diet, from our point of view, doesn't bring in the pesticides, the waxes, the chemicals that have to be processed and gotten rid of. Then each protocol for a cancer patient would also include supplements they take with their meals that are designed to help strengthen the body overall, and also large amounts of pancreatic enzymes. And pancreatic enzymes have been shown in some of the medical literature anyway to have anti-cancer effects going back 100 years. So there's large numbers of pancreatic enzymes. The net result is that a cancer patient on our program might swallow over the course of the day as many as 175 to 200 capsules. So this is not a protocol for people that have trouble swallowing pills, and that's something we ask people about up front. Because if somebody can only painfully swallow one pill at a time, it's going to be quite a burden. And then the final aspect of the protocol involves procedures that we feel can help the body get rid of waste materials. What that means, detoxification. On a practical level, what it means is coffee enemas. Coffee enemas have been around in the medical literature for more than 150 years. And they can be, something that they help patients feel better without a doubt. What we believe is happening is that it's helping the body get rid of the waste materials that can form as the enzymes do what they're supposed to do. What they can do is create bits and pieces of cancer cells in effect, and that can give people symptoms rather similar to what they might get if they caught the flu. The coffee enemas help with that. And almost universally, our patients tell us that the coffee enemas have become their favorite part of the program. No one ever believes that before they try them. I didn't believe it myself, but they definitely help people feel better.